Hi, everyone. I'm Stella Safo. I'm an HIV primary care doctor based here in New York City, and I'm so excited for this virtual event, in support of the LGBTQ communities. I'm an HIV doctor, as I've mentioned. I work here in Mount Sinai, Sinai West in New York City. HIV has always been, I think, at the front lines of this idea of health as a human right. As many people remember, HIV is less than 40 years old, right? Having been discovered in 1981. And when HIV came about, what we saw was a tremendous amount of misinformation, stigmatization, fear, and people were so scared that they couldn't even kind of provide the compassionate care for many of these young people that were affected and infected with the disease as they, suffered and died. And what we learned from HIV is that people who were the most affected by this condition had to advocate for themselves. And that ended up being white gay men. It ended up being predominantly African-American women at some points. It's been in the global community. It's been Black and brown people throughout. And HIV really, for me, is a starting point whenever I think about health as a human right and how we as clinicians want to make sure that we advocate for our patients. Because it wasn't the medical community that came kind of to the rescue with the story of HIV. It was advocates themselves, people who put their bodies on the line, people who took to the streets and demanded that the FDA and others really do what they had to do to allow medications to be released as quickly as possible, to ensure that there were civil liberties and rights that were protected for individuals who were infected with HIV. And when we think about, in less than 40 years, what we've done for HIV, we found treatments for it essentially that keep you healthy through the course of your life. When we think about how quickly we could do that for a condition, we should all take a moment and feel proud and feel a deep sense that we've come very, very far. Doesn't mean the work with HIV is done. HIV still predominantly affects the trans population. HIV predominantly affects individuals who are Black and brown. And globally, HIV has affected countries that are developing in a way that has had tremendous impact on their economic outcome. So the fight with HIV isn't done, but I stand here and just take a moment to say we have done so well. When we take the example of HIV, we have to then bring it over to COVID-19, which, as we saw in 2020, when it hit us in the US, there was the same response, that same feeling of the fear and stigmatization, initially among the Asian community and then down the line towards spreading towards other groups. That same sense of just confusion at knowing how we would treat this condition. And yet again, it is going to be the individuals that are predominantly affected by this condition that have to fight for it. And who are we seeing that in? Right now, as I speak, COVID-19 is it's infecting and killing Black and brown people at higher rates than it is whites. And it's not by accident that, again, we see a condition, a totally kind of neutral virus, reflect to us all these systemic ways in which our societies are unequal. The reasons why we think COVID may be affecting Black people more could be due to some underlying higher conditions that we see, such as hypertension, heart disease, etc. But before people get so kind of quick to say, well, Black people tend to be sick, let's just think about, why do Black people have higher rates of hypertension? Why do Black people have higher rates of diabetes? Could it be related to the conditions that individuals find themselves living in the inner city or in other areas where there are food deserts, where there's less of an access to jobs that allow you to buy the foods that are healthy, that are good for your body, that tend to be more expensive? And so there is a way in which we see the kind of targeting that COVID has really shown us of vulnerable populations that really mimics what we saw back in the day with HIV. And I think just as we saw with HIV that individuals from those communities had to speak up and fight for their rights, we see the same thing here with COVID. Not for nothing, we have to remember that when people do get sick, and these are people, again, maybe they have more underlying conditions, but they're also your essential workers. They're the guys and the ladies coming to deliver your Uber Eats. They're the people working in the fast food restaurants or in restaurants as they open up. They're exposed more, and so we see them getting sick more. We have to remember that even when they do get sick, their chances of losing their health care are higher. And so now you have a population at higher risk, in more risky situations, getting sick, and now not having the health insurance and healthcare that they need. And why don't we have this? Well, we know that in 2012, when the Affordable Care Act was rolled out, it was a huge success and a huge win all around. Since then, we have watched a tremendous amount of rollback of all of the things that we believed in for the Affordable Care Act. All of the things that we said we would have, like not discriminating against, individuals with pre-existing conditions, ensuring that more people can be placed into health plans that cover their conditions. We've watched Republicans and the Trump administration roll back these rights and roll them back in a way that means that when Black and brown people get COVID, they are not able to go safely to the hospital without worrying about coming out of the hospital with bills for hundreds of thousands of dollars. Now, we in New York City are lucky in that we have pretty progressive healthcare systems that allow you to have healthcare regardless of your immigration status, regardless of your insurance status, but that stuff still adds up. And so my message today is, just as we advocated within the HIV community and had really individuals infected with HIV on the front lines, we have to make sure that we rally behind Black and brown communities as they fight for their rights to not be disproportionately impacted by COVID-19. So one of the things that's been a real pleasure in being an HIV doctor is getting to talk to individuals who have been infected with the disease for a long time. And in one of my recent clinic sessions, one of my patients came in and we were just talking about George Floyd and Breonna Taylor and Ahmaud Arbery and all of these people who have been killed by individuals, by the police, but really by this country's history of incredible systemic racial violence. And this gentleman is in his 80s. He's had HIV for quite some time, really since the beginning of the epidemic. And he told me a story that I tell now because I want us to just understand that this stuff wasn't that far away from us in terms of our history. He told me a story that when he was a young man, he'd invited everyone in his class to a birthday party. And he had one individual in his class who was a Black man or a Black boy. We'll call that boy Billy. And my patient, was really excited to invite Billy to his birthday party. And Billy's mom called him the night before the birthday party and said, "Is this invitation real?" And, my patient was like, "What do you mean, is it real?" And she said, "Well, Billy's been invited to parties before, and when he's gotten there, he's not been allowed to step into the house." And it gave me chills because this patient was talking to me about growing up in the Northeast, talking to me about this experience that he had as a child growing up in the Northeast not very long ago. Sure, 60, 70 years ago, 80 years ago seems like forever. It's not very long ago. And it's, again, a good remembrance that in this country, Black people in particular have spent more time under conditions of either outright enslavement or Jim Crow Reconstruction, or, name any of it, right? Mass incarceration, all of the things that have really decimated these communities. And in him telling me the story that he remembers very vividly from his boyhood, it just reminded me and it made me think all of the ways in which we are suffering and kind of being challenged by systemic racism in this country. All of these things are because we haven't acknowledged our history, which is a very, very present and recent history. If we think that we are going to be able to just, take a couple of experiences of performative racism and kind of yell, Black Lives Matter, and that's it, for a protest here and there, and that's it, we have to know that we're in this for the long run. And I'm so proud of all of the individuals like you guys that are meeting virtually in person, that are calling for these systems to change. Because the change that has to happen has to undo hundreds of years of systemic racism and violence and injustice. And I think as people start these battles, we have to go back and ask ourselves, not just from the history books, but people that we know, people that are walking down the streets now, what was it like when you were younger? What was it like that was normalized then that maybe we still see remnants of now? And so I just want to leave that with you because that story really, really impacted me. I think another issue that we really do have to address is the issue of mass incarceration. I think, as many of us know, there's a systemic effort, I would say, at this point to really take the futures of young Black people, Black and brown people in this country for offenses that we now agree are not offenses. How many people did we put into jail for smoking marijuana, and now people smoke marijuana on the streets? How many people have been put into jail for having, less than, however many ounces of illegal substances that when I was at Harvard, I would actually watch classmates go ahead and use. And the only difference is that the people who were putting in jail tend to be Black and brown. One of the things that I think is really powerful, that I really applaud my fellow physicians for doing, is delivering healthcare within the prison system. And so for a while, I worked at Rikers, and I worked with HIV patients at Rikers, and I will say, to down to the person, the majority of people that I saw in there were Black and brown people. And it isn't as though our society is 90% African Americans and Latinos, et cetera, right? We only represent, Black people represent 13% of this country's population, yet somehow they make up over 60% in some places of the individuals that are incarcerated. And so in my time working in Rikers, I was really struck by the predominance of individuals that were in these programs, or excuse me, that were in this jail. And I will also kind of note that the area that really kind of affected me is just their access to healthcare. There's so much that would happen within these prison systems, and many doctors don't want to work there. Why would you train at an elite institution and then go and work at a jail where the conditions are not great, where you might ask for better treatment for your patients, and that would just be disregarded because they're quote unquote criminals. And in my time working there, I came across some providers that were excellent providers that really deeply cared about their patients. And if you look at the healthcare delivery now at Rikers, under the leadership of some incredible doctors, these are people who are highly trained, who care deeply about this population. As part of that work, what has been set up is a transition program to be able to take some of these individuals when they are released from the jails, and transition them back into the community in a way that's safe. And I really applaud those programs tremendously. It's important to note that one of the ways in which our governor and our mayor failed us during the COVID pandemic, although they did many, many things correctly, is that their response towards the incarcerated population in many ways was very anemic. There wasn't a plan for individuals who could be released early and released safely and transition back to home. There wasn't a plan for how to, socially distance individuals within these jails, which would put a population, that is already vulnerable because they're at the mercy of the state, essentially, at even a higher level of vulnerability. And that's an area that really all of us should make sure that we're kind of aware of and we are looking at, because if you're going to take on the responsibility of jailing individuals, again, predominantly Black and brown individuals, you have to make sure that you're, just as you would any other ward of the state, taking care of and providing them basic health privileges and benefits. One of the things that I saw in the jail system that is worth remembering, and this really calls to mind the story of Khalif Browder, who was jailed for, if my recollection is correct, they thought that he stole something in his backpack, and he was jailed and held for months before he was released. By the time he was released, he was so mentally just destroyed by it that years later he ended up committing suicide. That death is on our hands. And when you think about stories like that, the conditions again within these jail systems are incredibly important for all of us that are on the outside to advocate for. So while we're on the streets, calling for Black Lives Matter, we have to remember that Black Lives Matter, regardless of whether you're a professor, whether you're a lawyer, whether you're a Harvard-trained bird watcher, whether you're an EMT worker, whether you are unemployed, whether you are in jail. Black Lives Matter every which way you cut it. And that goes for our brothers and sisters that are incarcerated as well. I am so proud of the work that you guys are doing, being on the streets, putting your bodies out there to call for equal rights for all people everywhere. And I want to just remind us of the importance of taking care of your health first. If you're healthy and you're not sick and you're okay, you can keep doing this work. You can keep helping other people understand all of the issues that affect the trans community, Black individuals, brown individuals, underrepresented minorities everywhere, immigrants, all the populations that are so vulnerable. You can help us continue to do that work as far as you keep yourself healthy. So please wear your masks. Please use hand sanitizers to clean your hands if you're going to be out, for some period of time. Please, as much as you can, try not to be too close to individuals, just because once you get infected, that is going to be the way that you'll be spreading it to others. And all of this really ties to what we need to do come November 2020, which is to vote. I know that many of us feel in some ways disenfranchised, or just like our voices are not being heard, and that we're yelling at the top of our lungs for things to change and that nothing will happen. But if we can get out there in November and vote so resoundingly that it's clear that we don't want the Republicans in presidential office, in Senate, in Congress, it will allow us to at least get someone sensible into government so that we can start doing the hard work that we need to do from the top down. If we vote in November and it doesn't turn out the way that we want it to turn out, just remember that a lot of what you're voting for as well is for these local elections. And these are the individuals who are your sheriffs. These are your judges. These are the individuals who determine, what happens to the funding with the police. So whatever happens, I need everyone out there on the streets today to stay healthy, to stay vibrant, to just do everything you can do to protect yourselves and your communities. Yes, it's because I want us to vote and I want us to just show up in November and do what we need to do. But also it's because in this country, if you believe that the bigots are out there to kind of target individuals of color, minorities, and others, your ability to just be alive and be well and to have joy, that in and of itself is a form of resistance. So let your joy lead you, protect your health, and please, come November 2020, vote.